I'm Joanne Starks of SEDL, or CEDL, in Austin, Texas, and I will be moderating today's webcast on research for real-life problems, relevant, reliable, and readable. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, which is funded by the National Institute on Disability and Rehabilitation Research, or NIDR, in the U.S. Department of Education. I want to thank my colleague Ann Williams, our webinar administrator, for her logistical and technical support for today's webcast. A reminder that we will ask you to complete a brief evaluation at the end of the webcast. I'll give more instructions following the presentation. And remember that you can download a copy of the PowerPoint file from the KTDRR's website at www.ktdrr.org. The Center on KTDRR is working with a number of national and international partners, and we are pleased to count the Evidence for Policy and Practice Information and Coordinating Center, or EPPI-Centre, among those partners. The EPPI-Centre is part of the Social Science Research Unit at the Institute of Education, University of London. Since 1993, the EPPI-Centre has been at the forefront of carrying out systematic reviews and developing review methods in social science and public policy. Today's webcast is the second in a series of webcasts presented by staff from the EPPI-Centre, and will focus on why research results may not be used today and how to resolve the issue and get more reliable and relevant research into use. Now I'd like to introduce our two presenters. Sandy Oliver, BA, PhD, FHEA, is Professor of Public Policy in the Department of Childhood, Families, and Health, and serves as Deputy Director of SSRU and the EPPI-Centre. Her special interest involves making knowledge more democratic through public involvement in doing and using research, and synthesizing and sharing research literature. 10 years as an advocate of maternity service users was followed by an academic career developing systems to support public involvement in research and policy nationally and internationally. She is an editor for the Cochrane Consumers and Communication Review Group. Next, Rebecca Rees, MA, MSc, FHEA, is Senior Lecturer in Evidence-Informed Policy and Practice in the Department of Childhood, Families, and Health. Ms. Rees is also Associate Director of the EPPI-Centre. Her background is in social research methods and research in education, public health, and complementary medicine. Research interests include the synthesis of diverse types of research, especially studies of people's views on or experiences of social phenomena, research ethics, and the active participation of stakeholders in research, the production and use of evidence in diverse fields, including education, public health, and health promotion, the use of information and communication technologies in teaching and learning. I'm now going to hand things over to Professor Sandy Oliver to start today's presentation. Sandy?
Thanks very much, Joanne. Thanks very much for the introduction. Rebecca and I are very pleased to be here to share some ideas about making the most of research. We're going to think about why sometimes research is left on the shelf and some solutions for making research more likely to be used, either by making it more reliable by drawing on multiple studies, or making it more relevant by involving different stakeholders in guiding what research is done and how. And then we'll think about some ideas for getting research findings used. Now, we expect that anybody logging into this webcast has some ideas of their own about why research is sometimes left on the shelf and how difficult it is to get the findings used. To get your head in the right place to think about what we have to say, you might like to pause this presentation and just think for a little while about your own experience and what the difficulties are of bridging that gap between the research community and the people outside who could really make use of the research if they were helped. You may think about examples of where research findings have really made a difference, and think about what influenced those decisions and what made change happen. We'll offer some suggestions here, but you'll get most out of the webcast if you can apply those ideas to your own field of interest. Here's what we've been told by a policymaker where he thinks he and his colleagues get most of their ideas. Phil Davis used to work in the Cabinet Office in London, and he talked about policymakers drawing on experts' evidence, building relationships with individuals, consultants or think tanks, then being influenced by lobbyists and pressure groups offering their opinion-based evidence, or the ideological evidence of party think tanks or manifestos. They get lots of ideas from the media, now more from the internet, and lay evidence from constituencies and ordinary people's experiences. And the street evidence, the urban mess, the conventional wisdom, the taxi drivers. And at the very bottom of the list is the research evidence. This may be a bit disheartening to researchers, but there's a lot to think about in how to get the research evidence higher on the list. Important decisions can't rely on research evidence alone. That research evidence, even when it's found and thought about, has to be combined with the experiences of the decision makers and the people that they're working with. It's combined with judgments, values, taking into account resources available. So the research evidence is only a small part of the picture. But even so, there are huge barriers to getting the research evidence used. Researchers themselves aren't always very good at getting their research findings used. They may lack the time and the money to talk about their research widely, bring it to the people well placed to use it, or they may not have the good skills for doing that. And certainly until very recently, they lacked the professional credit for disseminating research. In academia, it just wasn't seen as an important part of their job. Fortunately, this is beginning to change. There are also barriers to people outside engaging with research. They're also busy. They may struggle to understand the research they come across, or they may understand it perfectly well but find that it hasn't come across their desk at the right time, or it isn't relevant to the issues that they're struggling with. They find it too controversial, or there's a risk of upsetting the status quo. It may even threaten their own skills, their professional skills and their experience, and they may wish to not engage with it. They may value other sources of information more. In fact, they may be working in a culture where research just isn't valued either, at an organisational level, or where there's actually a culture that's hostile to research. So these two groups of people have difficulty engaging with each other. Getting research off the shelf requires researchers to enter the world of decision makers, or the decision makers to enter the world of researchers, or creating a shared world for doing and using research together. And we'll offer some ideas about how to go about this. Rebecca, would you like to take up the story here?
Okay, so I'm going to talk about one of the first solutions that was mentioned earlier, making research more reliable. So here the idea of relying on more than one study is really important, but how do we do this? So we can use research to inform decisions, but there are dangers of this if we just use one study. So an individual study would maybe be too small to show real findings over and above the noise that's often there in research, just variation you get by chance. The studies might be poorly done. We know there's variation in how well studies are designed and implemented for lots of reasons. They may not share the same context as the one you're interested in. Say you're interested in more in disadvantaged areas and what happens in them, and the research might be from a more affluent neighbourhood. Or you might be interested in all sorts of different geographical areas. The results themselves might be spurious in some way. They might not follow from the findings, or they might stretch them a bit too much. So it can be a good idea to consider more studies as a group. You're clearly here going to find more people who've been studied and more data points that you can use, or more detail in that pot of data that you get hold of. You can choose better studies. If you have a wider selection, you can be selective, assuming that some of them in there are better done. And you will get a range of contexts, hopefully, so that you can select the more relevant ones for your problem, or look for similarities or differences between, for example, the different settings that you're interested in. And if you have a bigger pot of studies, then you can get a good idea about average results, or get more precise results, and then have more confidence in what you're saying. Or if you have a diversity of studies, then you can start again asking questions about how things vary. But then you have to ask yourself, how do you choose this pot of studies to pull together and think about? Should you just find the ones that are easier, those that you already know, or those that are in journals to hand? Or should you maybe just have the ones you like, or even those that you've done? You can see immediately with these more kinds of traditional approach what people have tended to do when they're reviewing the literature. Some problems. Our own interests and biases, conflicts of interest even, are coming to the fore. And these studies can be quite different from others that are out there. The studies that are easier to hand, for example, including those that are published in English, are systematically different. The findings say different things than those studies that are harder to find often. Positive findings, for example, especially about services, studies that have positive findings are far more likely to be published, and far more likely to be published fast. So people have designed more systematic approaches so that, for example, you focus on those that are relevant, those that are well done, and you use approaches that are very careful how they look for studies to help find, for example, all of those that are out there. And these more systematic approaches can make a difference to the research and also to people's lives. Here's an example from America in the late 1990s that some of you might know of. So the context is calls from people for laws to reduce the problems associated with drink driving, to try and help people reduce the amount of alcohol that are in their blood, to reduce the number of so-called alcohol-related crashes. And at one point, the US government was reporting there seemed to be evidence that suggested initiatives that tried to look at alcohol in the blood and reduce that didn't actually help reduce the number and severity of crashes. When a systematic review approach was applied to the research, so looking for all the research that was out there, looking for good studies, being very careful about how that was all defined, this review, pulling together studies, suggested that such laws could be expected to drop the fatalities associated with alcohol and traffic by about 7%. So pulling together all the data suggested these studies were coming to the same conclusion. Legislators were persuaded. And importantly, money was involved. Money was withheld from those states that didn't pass laws, and a large number of lives thought to have been saved as a result. Now I'm now moving to slide 16, which is a lovely picture. I've got a couple of pictures now, because we won't go into much detail about different methods for making research reviews more systematic, but we thought we would flag up a couple of ways in which reviews can be systematic and yet still include a range of different kinds of research studies and answer different kinds of questions, both quantitative and qualitative studies, if you like. So it depends on the purpose of the review, which one you might want. So one way in which reviews can vary is in terms of what they do with studies. And here, this first one can be thought of as a review that simply adds up or aggregates the findings of similar studies to indicate the direction of change, just like a cairn. For people that don't know what a cairn is, you find them in wilder areas of Scotland, and they're piles of stones which let walkers know the direction of the path that they want to take. This is a particularly prominent one. They're normally smaller than this. And this kind of review is adding up studies to answer a research question, which would then provide a more reliable measure and indicate a way forward. For example, what's the effect of a particular intervention for people? But at the other end of the spectrum of purpose is a review that instead can be thought of as arranging the findings of different primary studies to answer a research question or to configure them. And this can help us get a more meaningful picture of what the research is telling us. So, for example, what are people's views on a topic? What do they think influences their behaviour, or what is valuable for them? And this kind of review will need more interpretation. It varies in lots of ways. I see a tree here, it's full of life, supporting life. Other people might see the apples that seem to be going bad at the bottom of the tree. Okay, I'm going to hand over to Sandy now to move on to, I think, the second potential solution that we're going to talk about today. And I think we're now on slide 18.
Thanks, Rebecca. Yes. So Rebecca was talking about making research more rigorous, using research more rigorously by drawing on more studies. And I'm going to talk about making research more relevant. The studies in this slide were actually conducted not by researchers, but by mothers of young children who were working together in a peer support group. And those studies tell us what was really relevant to those women. The studies weren't necessarily hugely rigorous, but they were very useful for raising an agenda. Researchers instead may be better at producing really rigorous research, but it isn't always relevant. So this is a story about the problems of research that doesn't quite speak to the people who are supposed to be taking notice of the findings. In 1995, there were a series of systematic reviews about different ways to help women give up smoking when they were pregnant. and it was offered to health promotion specialists to try and encourage them to use research when in their work. But when the health promotion specialists read these reviews, which looked at different ways of helping women give up smoking, they were unimpressed by the research, because although it measured how many women gave up smoking, there was no mention of any of the theories underpinning the interventions, whether the interventions were harmful in any way, and no mention of the emotional or social outcomes or the social context of women smoking. And this is important because women quite often smoke using it as a prop. It's a coping mechanism. And giving up is extremely difficult, and asking somebody to give up at a time in their life where they may be facing other challenges may make life just too difficult. And the health promotion specialists were concerned that there might be harms in taking away a coping mechanism, and that it may interfere with the women's relationships with their children and their partners. In the review, there was also no information about how to implement the interventions. So the practitioners felt that the reviews were a totally inadequate justification for intervening in women's lives. This was the beginning of reviews conducted by the Cochrane collaboration, which is committed to updating reviews. So having got this criticism, when this work was updated, it took into account a much wider range of interests, so that 10 years later there were many more trials included in the review, and the review looked far more closely at all the issues that had been expressed not only by the health promotion specialists, but also what women were saying, women who had smoked either before or during pregnancy. So that the review that's available now, it does address the potential harms and tells us that some of these fears are not substantiated. It does cover the theories underpinning the interventions, and it covers the emotional and social outcomes, and gives information about implementing the intervention. And that review now, instead of being dismissed by health promotion specialists, is actually cited in policy support documents internationally. So changing the original research has made the research much more appealing to the people well placed to make use of the findings. So thinking in terms of systematic reviews, you can see that research isn't just a technical exercise, but it involves a lot of judgment. The first judgment is framing the review question, and which questions are important will differ for different people. In a review, there are judgments made by the authors of the studies included in the review, and judgments and opinions expressed in the data included in those studies. In reviewing those studies, there are judgments made in designing the review and the review tools, and judgments made by the reviewers who are handling the data and synthesizing it. And then finally, there are judgments made by those who interpret the review findings. Having what at first thought might be considered a technical exercise actually being seen as much more subjective, we find it very useful to involve a whole range of people in advising a review team about what's the most important question and what are the issues that need to be looked at in conducting a review. And these are reviews that have been done, that have drawn on the expertise of people outside of the review team to shape the review. Those people aren't giving the findings, they're focusing the review for the researchers who look most closely at the issues that are most important. So, for instance, the young people in research, the National Children's Bureau have worked with the EPPI-Centre to focus some of our reviews, and Rebecca will talk about that a bit later. And the Conflict Resolution, Peer Mediation and Young People's Relationships Review was actually conducted with children and teachers in a school. And the review of interventions for looked after children in school was conducted in partnership with young people who had been looked after by a local authority. In both those reviews, the young people were involved beginning to end, working alongside the researchers, so that at the end we were more confident that the findings were relevant to their lives and the lives of people like them. Once the review is complete, or any research is complete, whether it has been conducted in a participatory way or not, there are different ways of trying to get the research used. So we're now moving on to slide number 24. The most common way and easiest way to draw attention to research is a press release. Universities give out press releases every day of the week. It's a fairly simple thing to do, and it may or may not attract the interests of journalists who may or may not act upon it. Journalists, like policymakers as well, are more likely to be attracted if there's a personal interest shown in the research findings, alongside the research findings. Research findings themselves can sometimes be very dry, but stories that illustrate the meaning of the research findings can be very powerful and offer hooks by which policymakers or journalists can get hold of an issue and discuss it more widely. Now there's much more effort being put into helping researchers develop the communication skills necessary to engage the wider public in their work. And this is an example from the National Coordinating Centre for Public Engagement in the UK that is trying to help universities develop a more open culture, open listening to the world outside and working with the world outside and sharing their findings with the world outside. There are some straightforward guidelines for working with the mass media, and this comes from some guidance that's published about how to write press releases succinctly, how to provide stories, avoiding jargon, giving access to experts, and tip sheets. The other side of the coin is training for the non-researchers to understand research. And there are a few examples of trying to train journalists to be more critical about how they pick up research findings, and considering the strengths and relevance of the research rather than the hype. Instead of spending time just trying to get research out there, an alternative approach is working with professionals in their places of work, encouraging them to develop the skills to access research, think about it critically, and use it for their own practice. This is happening widely in healthcare, where clinicians are expected to draw on research and critically appraise it. And it's growing in other professions, such as amongst teachers or the police force. But they're not the only people. This is a paper that is written by and for not professionals, but actually the same mothers of young children that I mentioned earlier, working with their peer support group with the National Childbirth Trust, where they are developing their own skills in being critical readers of research, so that they don't take research just on face value, but check its rigour and its relevance before sharing it through their network. And here's a source for finding research. This source, which is publicly available on the web, provides access to systematic reviews and the included studies, and it's offered in multiple languages. It's a very exciting initiative that is making research more accessible to many more people internationally. I'm now going to hand over to Rebecca, who's going to talk about slightly more sophisticated ways of getting research off the shelf.
Okay, Sandy's talked about ways of encouraging research use that are framed around pushing research and out to people who might want it, or people who want research, pulling research into their lives. I'm now on slide 31, and I'm going to talk about a couple of examples of systematic reviews where we think the relationships are a really important component to think about that will help research be informed by people's everyday lives, but also essentially help that research get out there. One set of terms that is used, which I'm going to use, is this idea of a continuum from consulting with people, researchers consulting with others, right through to collaboration, where researchers are working more in partnership. And the two examples I've got, they had elements of both in them, but the first one is more of a consultation, more at that end of the spectrum, and the second one is more collaborative, and I'll try and illustrate the two. So this first review, which involves more of a consultation approach, relationships with people, consultations tend to ask people for their views and use them to inform decision making, and it's common to either write to people to ask for their views, maybe using plain English in the UK, but also maybe one-off meetings to interview people and hear what they have to say. This particular review was funded by the Department of Education in the UK. They wanted to know, are there any links? What are the links between childhood obesity and educational attainment, how well children do in school? So that question was already set, although you can see it's quite an exploratory question, not exploring one particular set of links, it's open. And with this review, the review team were able to hold meetings with a group of young people. Sandy talked about this group earlier, a group that was already set up to investigate public health, and we worked with them through one workshop. We were also able to have an email exchange with teachers, and that approach used questionnaires, and I think there was a bit of toing and froing of emails to follow up people's ideas. In the workshops with young people, the techniques used were mainly sort of pair discussions between young people, presentations from the researchers, sticky notes being stuck on pieces of paper to represent how ideas might be joined together. And the young people were, and the teachers were asked to identify factors that they thought might be important when you were thinking about how obesity might be linked to academic performance. And there's an example on this slide of a so-called causal pathway. Obesity can lead to discrimination, which might lead to low self-esteem, which might in turn lead to low academic performance. And the young people were asked, what factors do you think might influence low academic performance if you're obese? And they were also asked about these pathways. How did they think these different influences might act? And this review was interesting because we found that the variables that the researchers had looked at in the research literature were very different from the factors that were identified by teachers and young people. Both teachers and young people tended to emphasize mental health. So obesity might not be such a problem if your mental health was really robust, or obesity might mean that you suffered depression, especially if you were being bullied at school, for example. Teachers picked up on poor diet, but the research literature didn't really focus on mental health. In fact, they tended to have done analyses of things that were quite easy to measure. So we picked up on a mismatch between the research literature and stakeholders' views. Through a relatively quick, not too resource-intensive approach, more of a consultation, we think. This is an example, on slide 33, of a review that was more at the collaborative end of the scale. So here, a collaboration is generally thought of as a more interactive, more active, but also importantly, people working, thinking, talking with each other, more ongoing partnership. So something that develops over time between researchers and others in this case. And because you have more time and it's more interactive, there's much more opportunity for stakeholders to actually influence the research, more opportunities for developing shared understanding. What do you mean by that? You can ask for clarification, for example. And I'll just illustrate that through this case. The project was a systematic review funded by the Department of Health in England. They set the research question, but it's quite broad. You can see what's known about the barriers to and facilitators of HIV health promotion for men who have sex with men. They wanted us to do a review of the literature on what effects different interventions might have for promoting sexual health, a more aggregative type of review, the Cairn example that we talked about earlier. They also wanted us to do a more configurative review that made meaning out of studies that were more qualitative, studies of men's views. But other than that, it was a very open question, and they were interested in this group having influence on the review. The funders were interested in this. The mechanism for this was 3 advisory group meetings where a range of stakeholders were involved, and they were encouraged to discuss with us what the research looked like, the kinds of research that was there, and they were also asked to take part in some more formal consensus development activities, which I'll get onto in a minute. So this more interactive approach, and I've done a cycle here because we started with a research question, the advisory group met a couple of times, and then the second discussion was to look at our initial findings. It gave us more of an opportunity to get to know each other and to also build on some existing relationships. Some of the stakeholders had already been working with each other. We had formal and informal discussions outside the meeting space because we met face to face and during meetings. The more formal consensus process that I mentioned, the group selected the actual outcomes that we should prioritise in our review of the effects of interventions. They selected outcomes that we should prioritise in our analysis. So they had a direct impact on the research. They actually influenced the decision. They participated in decision making, which some collaborative work can do, but you can see how the more consultative work can't do that. It's far more one-off and at a distance than this kind of approach can be. Sandy, are you okay to carry on?
Sure. Okay, thank you, Rebecca. Okay, so the last way that we think of getting research off the shelf and into real life are systems models. Now these are less likely to be within the grasp of individual researchers or research teams, or within the grasp of individual research users, but they're becoming more important as there's a growing movement towards evidence-informed policy and practice. So here on slide 35, we note that using research evidence is becoming more common at the heart of government. So this is the Cabinet Office in the UK, their Social Exclusion Task Force, encouraging their staff to look carefully for research evidence to inform service development. And they actually give guidance on how their staff should find the relevant research evidence, how they should appraise it and review it and use it for service planning and for planning evaluation services are rolled out. And in fact, we now have government civil servants attending some of our training courses to learn how to do this so that they can fulfil their professional duties better. There are also government agencies who invest a huge amount of time and energy into developing guidance for services, and this is the National Institute for Health and Care Excellence. I'm sorry, change its name. And they have, we've listed here some of their public health guidance, but they have much more in the area of clinical health care, and there are similar agencies in other countries. And this guidance is put together not just by somebody sitting behind a desk, but by convening mixed groups of people from each different part of the system relevant to a particular problem, so that they bring all that experience together to discuss the relevant research, phrase it, and draw out the recommendations from it. So we've touched on three main ways of turning knowledge into action. The linear push-pull models, where knowledge is seen as a product that's moved between different groups of people. This requires very clear communication. We've talked about the relationship models, where people work very closely together, share their ideas and learn from each other. And we've mentioned systems models, which are for complex adaptive systems that makes change happen through a whole series of stakeholders who are interrelated in different ways. So it's important to think how to choose between these different models for getting research off the shelf. The linear push-pull models, such as the press releases, the critical appraisal skills and briefings, they're helpful for ideas that can pass easily between different groups of people. These ideas tend to be clear, simple, easy, and cheap to try out. These models work well where there are strong institutional structures and resources for passing those packages of knowledge around, where there's a supportive structure and incentive for changing behaviour. So one example for this that worked really well was sharing news, the new idea when Google first came out, if you can remember that far back. It was such a simple idea, it was free, and it was very easy to try out, and therefore news spread very quickly, and lots of people took this up, changed their behaviour about how they looked for information on the internet very quickly. But that doesn't happen easily for all ideas. So here on slide 39, we think about the relationship models that happen with the advisory groups and collaborative projects. These work well where ideas are more complex, where you need local knowledge as well as research evidence, where if complex problems are going to be addressed, they need changes in systems to happen, and that can only happen if it's supported by a range of people. And these relationship models are required, they work well if the two-way communication and close collaboration is well supported. It's not something that can be done quickly without thought. And the systems model for developing formal guidance, this is required in complex systems where change is going to influence a lot of different types of people, and key stakeholders from those different groups can play a role in understanding the problems and seeking the solutions. But this needs organisations to invest time and resources. And this works well if getting knowledge into action is actually part of an organisation's strategy. So here's the reminder of what we said earlier. Getting research off the shelf requires researchers to enter the world of the decision makers, or the decision makers to enter the world of researchers, or to create a shared world for doing and using research together. How this is done depends on the complexity of the change required and the resources and contextual support available and the enthusiasm that people have for moving out of their comfort zone into somebody else's world. You can find more ideas about what we've been discussing today in our book called An Introduction to Systematic Review. Thank you very much for listening.
Thank you.
Well, thank you very much, Sandy and Rebecca, for a very interesting presentation and for identifying a number of helpful examples and resources for us. And I wanted to thank everyone today for participating in the webcast. Before we close, Sandy, I wanted to ask you and Rebecca if you have any final words for us.
I think we'd be interested to hear how people listening to this webcast apply these ideas in their work. And when we are teaching our courses, we find we learn as much as the students do who come to us.
And wherever you are in the world, we're interested in your ideas. We teach at a distance online as well as face-to-face here in London, and it's wonderful to hear about ideas about how research can be done and who can use it from Singapore, South America, Africa,
Malta,
America, Canada, Europe, the rest of Europe. Even when we're sitting at our own desks, it's lovely to hear all of this.
Well, thank you very much. I really do appreciate your efforts in sharing this information with us. We hope that everyone participating today also found the session to be very informative. And as a reminder, the webcast will be archived on the KTDR's website at www.ktdrr.org in the very near future. We do have a brief online evaluation form and would appreciate your input about the webcast. There will also be an opportunity for you to ask questions of our presenters and to make any kind of comments that you would like to, and we will be happy to share those comments with Sandy and Rebecca. The link is on the last page of the PowerPoint file, and everyone that has registered for the webcast will also get an email with a link to the evaluation form. So once again, I want to say thank you very much to our presenters, Professor Sandy Oliver and Ms. Rebecca Rees of the EPPI-Centre, from the staff at the Center on KTDRR. We also appreciate the support from NIDR to carry out the webcast and other center activities. On this final note, I'll conclude the webcast and invite you to participate in future events. Thank you.